Once upon a time,
Honey, let's have 8 kids. I want to have 8 kids within 8 years.
What? How about let us ask for some advice in starting a family first?
But why? Don't you want to have a big family?
Honey, of course I do. But let us talk about it and ask Dr. Alfar about family planning.
Okay, fine.
Hello, Doc. Can you help us?
hello, Mr. and Mrs. Barcenas. How can I help the both of you?
We'd like to know more about family planning. We just want to do things the right way.
Oh, yes, of course I can. I can show you this video that my group and I made about family planning. It has all the information that you need.
That would be great, Doc. Thank you.
After watching this presentation, the couple will be able to 1. Know what is family planning. 2. Enumerate the elements of family planning. 3. Understand the benefits of family planning. 4. Know the different types of family planning and their advantages and disadvantages. 6 years ago, what is family planning? Family planning is voluntary and available methods of contraception, previously referred to as birth control, can be customized to an individual's needs with a range of methods that are acceptable to all and effective if used correctly. Family planning is having the desired number of children and when you want to have them by using safe and effective modern methods. Proper birth spacing is having 3 to 5 years apart, which is also best for the health of the mother, her child, and the family. According to World Health Organization, it is the use of a range of methods of a fertility regulation to help individuals or couples attain certain objectives, avoid unwanted birth, bring about wanted birth, produce a change in the number of children born, regulate the intervals between pregnancies, and count time at which birth occur. So, there are different elements of family planning: proper spacing, proper timing, and number of pregnancies. To reduce risk of pregnancy complications and other health problems, research suggests that waiting 18 to 24 months but less than 5 years after a live birth before attempting your next pregnancy. So it is always best to wait at least 18 months or 1.5 years between giving birth and getting pregnant again. Too little time between pregnancies increases your risk of premature birth. The shorter the time between pregnancies, the higher your risk. Premature babies are more likely to have health problems than babies born on time.
Benefits to the mother: reduce the health risk below 20 years old and above 35 years old, at risk of developing complications during pregnancy, physical strain of childbearing, reduce number of maternal deaths, reduce the risk of ovarian cysts. Health benefits to children: ensure better chance of survival at birth, promote better childhood nutrition, promote physical growth and development, prevent birth defects. Benefits to the father: allows fathers to keep a constant balance between their physical, mental, and social well-being, increases the father's sense of respect because he is able to provide the type of education and home environment. Benefits to the whole family: helps the family enjoy the better kind of life. Smaller families means more money and food for each child. Parents have more time to work and to be with the family. Delaying the first or second pregnancy lets young people stay in school.
There are 3 types of family planning. First, natural family planning. Second, Laurier family planning. Third, permanent or surgical family planning. What is natural family planning? Natural family planning means that there is no introduction of chemical or foreign material into the body. Practice may be due to religious belief, which means that natural way is best for them. Effectiveness varies greatly. It depends on couples' ability to refrain from having intercourse on fertile days. Failure rate is about 25% and poses no risk to the fetus. An example of natural family planning is the rhythm or calendar method. The rhythm method, also called the fertility awareness method, is a form of pregnancy prevention where couples calculate a woman's fertile time using a calendar. Abstaining from coitus on the day's menstrual cycle when a woman is most likely to conceive 3 or 4 days before until 3 or 4 days after ovulation. Woman keeps a dairy 6 menstrual cycles. This method may be used by women whose menstrual cycles are always between 26 and 32 days in length. To calculate, 18 from shortest cycle documented minus 11 from longest cycle is equals to her last fertile day. The disadvantages are the lifespan of the sperm and the reliability, which results to a failure of method.
One other method of natural family planning is basal body temperature, identifying fertile and infertile periods of a woman's cycle by daily taking and recording of the rise in body temperature during and after ovulation. Just before ovulation, a woman's basal body temperature falls about 0.5 degrees Fahrenheit. At time of ovulation, her basal body temperature rises a full degree. Because this is in the work of progesterone, this higher level is maintained the rest menstrual cycle. A disadvantage of this is it's not exactly a reliable method of birth control, especially for people with irregular cycles. Plus, outside factors such as lack of sleep can cause a woman's temperature to vary. Another method of natural family planning method is observing the cervical mucus. Cervical mucus is a fluid produced by small glands near the cervix. This fluid changes throughout her cycle from scant and sticky to cloudy and thick to slick and stringy. Each of these types of mucus is related to hormonal shifts that naturally occur during the menstrual cycle as her body prepares for and achieves ovulation. Right before ovulation, the mucus from the cervix changes from being cloudy and scanty to being clear and slippery. The consistency of ovulation mucus is like that of an egg white, and it can be stretched between the fingers. It is the peak of her fertility, and after the ovulation, the muscles tend to dry again, and these are also safe days. The ideal failure rate of this is 3%. Disadvantage for this is it's not particularly reliable method of birth control, especially for women with irregular cycles. Cervical mucus does not let you know when you will soon be ovulating, but sperm can live up to 7 days inside the vagina. Any sperm deposited ahead of time can still impregnate the woman.
Sympathothermal method combines the cervical mucus and BBT methods. Watches temperature daily and analyzes cervical mucus daily. Watch for the mid-cycle abdominal pain. Couple must abstain from intercourse until 3 days after rise in temperature or 4th day after peak of mucus change. Coitus interruptus, one of the oldest known methods of contraception. Couple proceeds with coitus until the moment of ejaculation, which offers little protection. Another one is lactation amenorrhea. It is a natural birth control technique based on the fact that lactation causes amenorrhea. How it works: breastfeeding interferes with the release of the hormones needed to trigger ovulation. Here are advantages. Breastfeeding on demand improves health for mother and baby. Nothing to buy or use. Disadvantages: can only use this method for the first 6 months after birth or until the first menstrual period. LAM does not provide protection against sexually transmitted infections. Barrier family planning. Couples can use condom, sponge, cervical cap, spermicidal, or diaphragm.
Other barrier family planning methods are male condoms. These are made up of polyurethane or latex. Silicone is used nowadays to produce semi-dry, pre-lubricated forms. Spermicidal, coated with nonoxynol on inner and outer surfaces. These are the advantages: simple placing method, no side effects, they are easily available and inexpensive, they protect against STDs. Disadvantages: chances of slip-off and tear-off, allergic reaction to latex. Female condoms is a pouch made up of polyurethane which lines the vagina and also external genitalia. It is 17 centimeters in length with one flexible polyurethane ring at each end. The advantages are: prevents STDs including HIV and AIDS, not damaged by oils and other chemicals. Disadvantages: only women who can use diaphragms can use female condoms. Slippage can occur, and it's also expensive.
Barrier family planning. Diaphragm. Most common and easiest to fit and use. Thin, nearly hemispherical dome made of rubber or latex material with circular covered metal spring at periphery. Diaphragm advantages. It's cheap. No gross medical side effects. Control of pregnancy in the hands of women. Reasonably safe when properly used. Prevent spread of STDs, though less effective than condom. Disadvantages. It requires help of a doctor to measure the size required. Allergic reaction to rubber. Erosion. UTIs. Spermicide. Available as vaginal foams, gels, creams, tablets, and suppositories. Alters the sperm surface membrane permeability, resulting in killing of sperm. Spermicide's disadvantages. Failure rate high when used alone. Can increase spread of HIV infection by irritating vaginal and cervical mucosa. Failure rate 21% with typical use and 6%. Advantages: no instructions by doctors and nurses. Easily available and easy to use. No gross medical side effects. Progesterone-only pills, mini pill. Contains just progesterone or progesterone hormone, causing plug of mucus in the neck of cervix. It blocks the entry of the sperm. Mini pills advantages: no side effect on breastfeeding or lactation. May be prescribed in patients having diabetes, hypertension, and smoking. Reduce risk of PID. Disadvantages: acne, nostalgia, headache.
And there are also other barriers such as vaginal contraceptive sponge, IUD or intrauterine devices, hormonal oral contraceptives, long-acting contraceptives, contraceptive injections such as Depo-Provera and Noristarand. And lastly, we have another type of family planning, which is permanent or surgical family planning method. 1 is vasectomy, 2 is tubectomy. So, sterilization is the most effective method of family planning. Its failure rate is 1 out of 2,000. In this, there is permanent termination. So, we have vasectomy. Vasectomy is a small incision made on each side of scrotum. Vas deferens is cut and tied, cauterized, or plugged, blocking the passage of spermatozoa. This does not interfere the production of sperms, but does not pass beyond vas deferens. And now, let's talk about the advantages and disadvantages of vasectomy. The advantages of vasectomy are the following. Very effective after 3 months of procedure. It is permanent and safe, and there is no apparent long-term risk. The disadvantages of vasectomy are: it is slightly uncomfortable due to pain and swelling after 2 to 3 days of procedure. Also, bleeding may result in the hematoma in the scrotum.
Tubectomy. It is one of the operative procedures where resection of a segment of both fallopian tubes is done to achieve permanent sterilization. The approach may be either abdominally or vaginally. Complications: ectopic pregnancy, loss of libido, menstrual irregularities, infection.
The end.
Wow, Doc, thank you so much. Family planning really is important.
That's very good to hear, Mr. Barcenas. I hope you both learned a lot. I am praying for your family and I wish you the best.